Well, it's a pleasure to be with you today, Bernie. Bernie is from CareSimple, and we've already had a blast getting to know each other a little bit in the last few minutes. We'll spend the next 15 minutes more learning a little bit more about CareSimple, your solution, what results are you seeing with health systems, what makes you different. But let's start with just introduction. I understand you're in a new role at CareSimple, so tell us a little bit about your role, how long you've been there, what you do.
Yeah, thanks so much, Sonia. I appreciate the opportunity to talk with you and share more about CareSimple and our experiences with RPM. My role at CareSimple is fairly new as VP of Sales and Market Development. I've been with CareSimple about just a little over 2 years now. I've got a long background of working in the digital health arena with telemedicine solutions, and it started in providing digital video integration systems for operating rooms.
Okay.
And then transitioned into facility-based telemedicine solutions, and then post-acute care solutions, mobile telemedicine, exam kits, and now into remote patient monitoring solutions that really extend all the way into the patient's home. So it extends that care into the patient's home. So I've had this view into digital health, if you will, from the most inner workings of the health system and the hospital enterprise, right, in the surgical rooms, all the way out to the patients at home. And it's really given me this visibility and a really incredible journey that seeing all the ways that digital health can impact a healthcare setting in so many different settings and use cases. And here at CareSimple, we're a fast-growing RPM provider that we've probably crossed recently over 25,000 patients onboarded across 35 healthcare organizations in over 20 states. So happy to be a part of that growth, and it's been really exciting here.
Well, that's really exciting. Congratulations on all your growth. And I love your background because it sounds like you've seen the evolution of what was very early stage, thinking about telehealth, virtual health, to seeing it grow and expand, move to new settings, enable new care models. As you think about what CareSimple provides, I always like to start with why, right? So what are the core problems you're looking to solve? Why now? Why are they important? And what is it in the stage of evolution of telehealth, virtual health that makes these really critical right now?
Yeah, kind of start off with our mission, really. Our mission here at CareSimple is really to help healthcare providers improve the care management for high-risk ambulatory patient populations through remote patient monitoring.
Okay.
What this gives to provider organizations is real-time actionable insights into the patient's health conditions, so they can proactively intervene and prevent serious episodic events and worsening of chronic conditions. I mean, this translates into avoiding ER visits and hospitalizations, and really at the end is results in lower costs of care, which is where we all want to get to, part of the triple aim. This means really kind of when deployed at scale, it'll improve chronic disease population health outcomes. It even adds an upstream layer that contributes to improvements in health system quality scores too, by heading off worsening conditions and improving the population health. We see things as really timely right now too. We're seeing a shift or a wave of evolution in remote patient monitoring that we're seeing accelerating interest in kind of a new generation of RPM solutions. Many of the vendor technology solutions that are in place were implemented in rapid response to COVID when COVID was raging, and it's really based on a quickly implemented set of now what is aging and unnecessary complex, hardware intensive solutions that really limit scale and are fraught with operational challenges. So we're seeing a big interest in wanting to replace these solutions with an enterprise-based solution that can scale, that's easy to operate, that works inside their EHR and their workflows, and can accommodate a wide range of care conditions and programs.
Very helpful. And do you have any focus areas and specific conditions or even demographics of populations, or are you broadly condition agnostic?
So we do say, and we do have designed our solution to be condition agnostic. We do focus on the most common chronic conditions. It's the bulk of our uses in the area of managing hypertension, uncontrolled hypertension, especially obviously heart failure, diabetes, COPD, some kidney disease. We're seeing a real increase in high risk maternity monitoring. That's receiving a lot of funding lately and a lot of use cases, and even post-surgical recovery type of post-discharge situations as well. And for patient population types, it really can vary, but if you're trying to optimize your program around fee-for-service and reimbursements, then you're going to want to prioritize Medicare patients because that's got the most consistent reimbursements. So we probably cover maybe more around the area of maybe 70% Medicare, and then the balance is either Medicaid or private pay. So it is a mix. But as health systems move more towards value-based care, then that population-wide approach applies, right? To workplace covered health plans, private pay, across the board.
Yeah. And knowing that there's many digital health remote monitoring solutions that are available, tell us a little bit about your solution. Where does it start and end? Is there a device included? How do you do the deployment? Give us a little bit of what exactly is entailed in your solution.
Yeah, so what we like to really emphasize with our partners is we provide that enterprise scale virtual care solution suite that can be fully integrated into the provider EHR and their care management workflows. So it really enables them to transform, new models of care delivery and at scale in an equitable way across their patient populations, but at their own pace, right? And however they want to consume the capabilities. We've built our solution around the pathways that a patient's care journey might follow, right? So we use automated care management, intelligence-based monitoring, patient engagement tools that enable care managers to get a more complete view of their patient status and prioritize the care really around those that need it most to avoid these costly exacerbation events. But what we've designed in addition to our platform being designed, we mentioned before, in condition agnostic type settings, right? We also have under the same platform the ability to offer a wide range of care programs that could include device-based RPM, deviceless CCM or PCM, chronic care management or principal care management, post-discharge, short-term transitional care management, TCM programs, and even hospital. So we've designed these so they can be layered in as needed and customized, right? So that you can really track a patient, whether their needs may start with an inpatient status at home under a hospital at home model, or for a short-term, very intensive monitoring, to be able to transition towards a transitional care model and really still be pretty intensive around keeping that patient from needing to be readmitted, to more of a longer-term chronic care management program using device-based RPM or deviceless, so that you can kind of follow this patient's journey and track this patient's journey and migrate them from one stage of care to the next, all virtually, so that you can have that longitudinal view as to the patient's recovery and really keep them healthy along the way and help them recover.
Yeah. I'm curious what your typical deployment approach and timeline looks like for a given health system. Like, what should they expect? They say we're going to do remote monitoring with CareSimple. What did that approach and timeline look like?
Yeah, it can really vary by health system. And it's, in this industry, I think we've all become quite aware of how long sales cycles can take. I think RPM is a bit unique too, in that there's so many variables to RPM, a lot of different stakeholders. But in addition, when you consider a patient's home environment, there's so many variables and unpredictable scenarios that you have to work with. So patient compliance is probably one of the most challenging elements in ramping up changing patients' behavior, consumers' behavior, right? It's always been a challenge. So there's so that can feed into the time. Some health systems maybe may have had some experience with RPM can quickly stand up a new program in weeks, right? And others may take close to a year to get it up and
Yeah.
fully, especially if they're doing a large scale, vendor assessment and several meetings, and then contract negotiations, and then EHR integration planning within EHR windows when resources are available to commit and do the EHR integration. So it can extend to months. So, but it can vary. What we like to say though, that if our clients are ready, we'll have them up and running either in standalone mode on our platform in 2 to 3 weeks, or with an integrated solution in about twice that much time, 4 to 6.
That's very helpful. I think you're so right. With any technology deployment that we see in health systems, it's technology, the actual tech deployment is just a small piece of it. And so much of it is adoption by the clinical team, buy-in from the leadership, the change management that's required, the patient adoptions, all of those pieces are really critical components for any solution. But again, coming back to the piece around remote monitoring and so many different solutions, companies in the space, if you had to tell a health system, choose us, this is why we are different, what would be the top 3 things that you would say?
Well, first off, number one, I would say it's about simplicity, right?
CareSimple, is that right?
You got it. You did it. The marketing's, the branding's working.
Yeah.
Yeah, no, that's why we even chose that name, and we stayed true to our name because we introduced an innovative model that simplifies the entire RPM process from logistics and patient device usage through to workflows and EHR integration, and streamlining things like billing to help it be more sustainable. But RPM, like I mentioned before, RPM is a complex service to manage, but we streamline that entire process. Things like in the area of EHR integration, we've got many installations working with a variety of EHRs, including Epic, Athena Health, and NextGen. But our most advanced integrations are with Epic user organizations. We've designed a solution and our integration setup so that health systems can decide on to what level of RPM workflows they want to run inside their EHR and custom build an RPM dashboard to do that, or to use all of the tools we've got built into our platform, which can even be used standalone. We've got some clients that have completely integrated or completely taken over the RPM piece inside of Epic, but use us as the logistics fulfillment piece of it, and they'll do the complete program run it inside of their Epic EHR, and use all of their tools that they're familiar with using every day, including MyChart, and we just fit right into that. So we give our clients the flexibility to kind of leverage everything we've got in our platform, or leverage their EHR to do the full RPM scope. The other piece is probably the third thing, I guess, is how our solution's device agnostic, with leading device makers for wearable devices even, as well as non-wearables. And all our devices come right out of the box with cellular connectivity. So there's nothing a patient needs to do other than put the device on, stand on the scale or whatever, and then walk away. They don't have a complicated tablet or hub to configure. There's no Bluetooth pairing to set up or to reset up if they lose pairing. There's no Wi-Fi needed, no app needed. They, like I said, capture a reading and they're done. So when you're dealing with complex patient populations, elderly, Medicare, comorbidities, et cetera, it is hard to get patients to, be compliant and to change their behavior. So we take away the friction so that can happen at scale. And then maybe the last piece, maybe that I'll add, it's probably 4 instead of 3 items, but
yeah, that's fine.
But additionally, our solution's built around really automated intelligence that's providing those actionable insights into patient risk and how do they get prioritized, and how do we offer in turn built-in best fit decision support tools based on the real-time data that's being about the presentation of the patient, right? So using this risk-based, risk-aware intelligence, we can sort those patients in near real time, according to priority, quickly and easily for the care team, and kind of highlight those ones that need the most attention. And really, it's like these proactive tools and decision support intelligence that can change the game in patient care outcomes and reducing and intercepting those avoidable hospital visits right before they have to happen. So that's yet another key component in our solution.
Very helpful. So I heard simplicity, I heard flexibility, the focus on removing friction from the patient's experience to even get it set it up and use it. And then some of these advanced intelligence things that are coming out, like clinical decision support is a big one that we are seeing a lot of interest in health systems as well. Maybe my final question here, tell us about what results, impact, KPIs we're seeing that a health system could expect if they engage with you.
Well, that's a great question. I mentioned before the complexity of RPM, and sometimes the most difficult thing is patient behavior, right? Getting them to change, getting them to take a more active role in their healthcare. So it's critical, right, to take the friction out of that and the lift for the patient. So by empowering the patients, right, to comply and get the data that the care team needs, it gives a more complete picture for the care management team, but both of the patient's current but also their historical condition, and it enables. It drives other things like not just patient care outcomes, but reimbursement, right? So the more that you can get your compliance up to the minimum 16 days of readings that CMS requires, that lets you more than pay for the technology, right? At about $48 per patient per month, right? So we help our clients excel in that area, and we do this example of some of the metrics we monitor for them, but typically the typical metrics we work on with our provider partners are, what are the improvements in the physiological readings, such as blood pressure, right? Are those improving over 90 or 120 days? What is your monthly patient compliance? And if it's underperforming, how do we get it up there so you can get reimbursed more, but you can also get better outcomes from your patients and treat them to goal? How much staff time is spent on RPM per patient each month. And that's another reimbursable component under CMS. So we try and give best practices around how to track that. And we have automated trackers built into our system so that they can act like a timer and a meter to be able to build that report at the end of the month for time spent. We work with our partners on what's your hospital readmission rate, maybe for these patients that you have on RPM, but 180 days before RPM versus 180 days after. Same thing with ER utilization. Have they been reduced frequency of ER use? What are the savings calculated? How do those translate into savings based on the use of RPM? And then more generally around experience, what's a patient and provider both adherence but satisfaction measures, right? And I'll give you some examples of some of these metrics. In one case, at a cardiology practice we have in Arizona, they've experienced blood pressure reductions of around 9 points in systolic measurement and 6 points in diastolic measurement over about a 90 to 120 day period on average. They're also reporting that they have patients with uncontrolled hypertension advance to improve to controlled hypertension state in about 120 days on average, right? And then they've also seen their compliance rates at a sustained level over the course of a year at about 95% compliance. So the 95% of the patients are getting 16 days of readings or more, meaning they're capturing that 99454 billing capability. And they've also got coverage across 90% of their patients hitting the minimum of 20%, so 20 minutes of staff time, so that they qualify for reimbursement across all those patients under 9457. And then in the area of avoidable utilization, one of our health system organizations in Ohio has reported that they have been able to reduce hospitalization by about 13%, and also ER visits by about 17%. through the use of RPM. And these obviously translate into huge savings for any health system that sees these kind of reductions, because the average cost of a hospitalization for a, let's say, a heart failure patient is right around $17K.
Yeah.
And ER visits can average about 2,500 on average. You do the math on those, and quickly it can be, big savings, but also many times overpay for the cost of the program.
That's right. Well, those are some great metrics. Thank you for coming prepared with some very specific and tangible results. Our audience is always very keen to hear specific results, KPIs, metrics that you've moved. So thank you for sharing that. Two, congratulations on continuing to have a focus on that. Any last or closing thoughts before we wrap up here?
No, I think key things I think maybe to leave you all with is you could see us in the online, a lot of different places. You can come to caresimple.com, of course, but we're also featured in the AVIA site.
AVIA Marketplace, yes, you can search for CareSimple there.
Right, as one of your top rated RPM vendors and your most recent top RPM company report. We're also #1 ranked full stack RPM vendor rated by Class Research, meaning that we offer all the aspects of RPM, including device-based and deviceless models. I think there's only one vendor that scores higher than us, and they're a deviceless only model, so they're not even really a true or a full RPM vendor. So, but we're there at Class's site for those that have membership there. Because of our leadership with the EHR integration, you can find us in the partner marketplaces on the major EHR vendors as well, such as Epic Vendor Services Hub, Athena Health's marketplace, NextGen's marketplace, and others. So, a variety of places that you can learn more about us.
Excellent. Thank you again for sharing. As you heard from Bernie, lots of places to find out more about CareSimple, and you heard a little bit about it already today. Just the capabilities, what makes it different, and the results that you're seeing already. So thank you for sharing that. Thanks for being with us today.
Well, thanks so much, Sonia, for the opportunity to speak with you today. And I'm really excited to see what great insights AVIA will continue to bring to the digital health marketplace.
Absolutely. Thank you.
All right. Thanks so much.